Hi everyone, thanks for joining us for our latest edition of Phoenix Children's Live. I'm Erica Sturwald, a brand manager here at Phoenix Children's Marketing and Communications Department, and with me I'm honored to be with Dr. Kathleen Van Leeuwen. She is the director of Arizona Fetal Care Network, which is part of Arizona Mother-Baby Care, which is a fairly new program that we announced earlier this year in the Valley for expecting moms and families. So today we're going to talk a little bit more about fetal care and how we coordinate care for mothers here in the Valley, and Dr. Van Leeuwen knows all about that, overseeing so many aspects of this program. So without further ado, let me just preface this with saying if you have any questions or comments, please put them in the comments below. We will answer them live. So feel free at any point in the discussion to throw your question in there, and we will make sure to get to it. If we don't get to it in the time that we have allotted for today, which is a half hour, we will respond to it in the comments later. So with that said, is there anything else you want to say about your introduction, Dr. Kathleen?
No, I just want to say thank you so much, Erica, for letting me have this opportunity to tell all the Facebook subscribers for Phoenix Children's about Arizona Fetal Care Network and Arizona Mother-Baby Care. And it sounds like, shouldn't we have already had something like this where we're taking care of babies before they're born, or moms who are pregnant who have questions? And the answer was we didn't really have anything like this in Arizona until a few years ago. So this is pretty exciting for me to help build something that's new.
Definitely. So yeah, you've kind of covered it, but let's go all the way into it.
Sure.
What is Arizona Mother-Baby Care?
Okay, so Arizona Mother-Baby Care is a program that is designed to try to help moms and families that are dealing with a pregnancy that has something scary or something high risk going on. So that could be that it's a high risk mom. So for example, a mom that has multiples. So you have twins, triplets, more babies than that even. That puts you into a category called high risk. So any mom who has a high-risk problem, no matter what it is, diabetes, obesity can make it more difficult to have a baby, a history of having babies that were premature. If you call our program, and our program number is 602-933-BABY, and that gets you to a person who will answer the phone and kind of ask you some questions about what's going on with you and help you kind of organize your care and try to figure out who you need. Now, we've been doing that for babies since 2013. So the Arizona Fetal Care Network is a program, exactly the same thing. If the mom or the family has a baby that something has been diagnosed in the baby that is a problem, it can be anything. And there are many babies in the state of Arizona that are born with something that needs to be addressed. We prenatally can set up that mom with a plan that involves what kind of things do they need at the time of the birth, and also what kind of subspecialty doctors will the baby need. And that goes across the state, across hospitals. It isn't unique to Phoenix Children's. It's who is the best thing for you and your baby, and that's who we set you up to see. And we feel like you can't know that unless you ask us, because we're in the business. So it's like having a friend in the business, people always say. But it is, like, you kind of need that. And we developed it because people were texting me to say, okay, Kathy, my baby, my mom or my wife is pregnant, and our baby has been diagnosed with spina bifida. Who do we need to see? And I would say, oh, well, I know exactly who you need to see. And so I would, or help organize those appointments for them. And then we realized you shouldn't have to text somebody who's a doctor. Like, you should be able to just get that service. And so we need to create that service. And we tried to do it in a way that's really neutral, because if, like, say Phoenix Children's doesn't have the best thing for your baby, well, then you're going to go somewhere else. There are some things in the state that we don't provide. But so it's our job to know, where is that service provided? Do you need to go to another state for something? And if you do, I feel like we should help you do that, because if you do it yourself, you don't necessarily speak doctor talk, but we can.
And it's like the Google complex of what you're going to get when you go on Google, right. Which is scary.
Right, it can change too.
Yeah.
So when you Google something, well, what if, like, the person who was the best person for your baby was at that institution and is now gone? Like, what if they've moved? Well, I will know where they moved, and maybe you can still see them.
And I can attest to the texting thing. I see you getting texts from moms all the time. This is not this is no joke here. So it's so clear the need for this was there.
It's totally necessary. And we also really, before we built the program, we went and visited some other programs, and it became clear that you really want to talk to someone too. You don't just want to like get online and fill out a form that somebody will get back to you, or just schedule an appointment to talk to somebody. Until we talk to you, we don't really know what you need. So we really wanted to set up a personalized system where you can talk to someone. So we have basically 5 coordinators. Some are for the babies, some are for the moms, and when you call, you're going to get to talk to that person so that they become that person walking you through the pregnancy. If something goes wrong, you can call them. If you have a bad experience talking to a doctor, call them. Call your coordinator, and they can help you understand what happened. So we've seen this has been extremely helpful to decrease the stress.
Yeah, totally.
Yeah.
And I think I'll move to the next question, but you kind of just said this. You want to call the care coordinator. Are you doing that if you're a high-risk mom, or you find out you have a high-risk baby, or is this any mom?
So it can be any mom. So we get a lot of referrals from the obstetricians and the high-risk doctors themselves. So say your baby is diagnosed with a problem. Say there is a hole in the diaphragm, and the diaphragm is a muscle that goes across your body that is supposed to divide your chest from your belly. But if there's a hole there, sometimes the stuff in the belly goes into the chest. So this can be a big problem for the baby. That can be diagnosed before the baby's born, and it's diagnosed when you're getting that ultrasound. So you're getting your first ultrasound at age 20 weeks, gestational age 20 weeks, and you don't know there's a problem with the baby. The baby's not acting like there's a problem, but they see that there's this hole in the diaphragm. So they're going to want to put you in touch with the doctors for the baby right away, because you're going to have a million questions and you're going to be super stressed about it. And so a lot of times those doctors who are doing the ultrasound will call us like that same day, or they'll say to the mom and dad, I'm going to put you in touch with the Arizona Fetal Care Network, or make sure that you can have an appointment very soon to talk about the problem for the baby. So that's the main time when we get a call, is when a problem has been diagnosed. And that's how you find out there's a problem with your baby, is your obstetrician is going to tell you. And then you want your obstetrician to also tell you the plan. And they don't always know the plan for the baby. They may have the plan for you because you're the mom, but they don't always have the plan for the baby. If there's nothing wrong with you or the baby, but you still have questions in general about pregnancy and the services that are available in Phoenix, you can call us, because the people that we hired to be these coordinators, they know everybody, and they're super experienced, and they've been here forever. So our main maternal coordinator, she's a lactation specialist, she's a licensed midwife, and she's just all around super cool and really nice.
Yep.
And so her name is Stacy Woods. So Stacy, if you were just pregnant for the first time and you don't even know who to go to, or you just want to ask about the obstetrician you've chosen, or you want to ask about where's a good place to deliver babies, we know all the answers to those questions, and we're super neutral about it. So you're not going to get directed to one hospital. We're going to ask you where you live, we're going to ask you your situation, and we're going to customize it for what's good for you. I didn't have this when I was last pregnant here in Phoenix, which was now almost 10 years ago. So I was just calling kind of randomly based on what people had said, like, oh, I really like this doctor or this doctor. And I remember I called a doctor that I was referred to, and they said, well, what insurance do you have? And I told them, and they said, well, you can't come to us. And I was like stopped in my tracks, I'm pregnant, I'm trying to figure out if I can go to this doctor, and I'm told no. So then I gotta restart the whole process, ask around. So that's the kind of thing from the very beginning that we can help with.
And I think that you raise a really good point just then, this is a service, like a natural progression of where services are heading today. You're moving to a new town even, for instance, and there's numbers you can call now to get your movers and your internet hooked up, and before you even walk in the door. And so this is just very similar to that. And actually, that brings up a good point too. We have a lot of transplants in Arizona who might not know even an OB that they want to go to. So that, again, they could call you for that.
Right, and we also feel like people should know the secrets of the business, and we know that. So certain OBs will only deliver at certain hospitals, and that's fine because they have a really good relationship with that hospital and they do all their work there. But what happens if you become a high-risk mom and they find out something's wrong with you or the baby? You might have to change hospitals just based on what's going on with you. And if your OB doesn't deliver at the higher level hospital, well, you need a new OB. And so I can tell you that's not a problem. Your original OB will understand that you need to move to a new OB. But we can set that up for you. We can call that office and say, I've got a mom who's now 30 weeks pregnant. She's going to deliver 10 weeks from now, and she needs to establish care with your office. We know who in town will say, oh, sure, yeah, I'll take on that mom, no problem. Because you having to do that is a very hard job. I can't even imagine how moms do it.
And with insurance and all of that too. And you guys look into
We look into insurance. So we look in and we make sure that we don't want people to have out-of-pocket costs. I don't want out-of-pocket costs for my family. So if I can get the services provided with the doctors that are within my insurance, that's what I want for my family, so that's what we want for your family. So if you call us and you say, I have so-and-so insurance, and that means I can only be cared for in these systems or these hospitals, that's where we're going to look for you. We're going to make sure that we look in those systems with you. That's our job, is to make it work and also for you to not have to pay anything extra if possible.
Yeah, really good. I think then we've kind of covered the first part, but I want to go into what specific services are available to high-risk babies specifically.
Yeah. So if you talk specifically about babies, there's a lot of services that we provide that you don't even necessarily know you need. So if you call us, we're first of all going to know which subspecialist you need to see. So you might not know. So say the baby is diagnosed with a heart problem. Well, you're going to need a cardiologist. You're going to need a specialty cardiologist for fetal heart care. And so we have that at Phoenix Children's, and so you would get immediately set up with a fetal cardiology consult. And that's been a very well-established program here at Phoenix Children's, run by Dr. Chris Lindblade. He's got a great reputation, and he's got a lot of doctors on his team. So we'll get you an appointment soon, and hopefully in your area, but sometimes you have to come to the main campus for like the first visit. So we'll set you up with that. We'll make sure that the appointment is scheduled, that we help you get through the door. If you have any problems with that, you call. But sometimes there's diagnoses where you don't even know who you're supposed to see, or if you're supposed to see anybody. We'll get somebody who, they have a problem with a bladder obstruction in the baby. Well, you might need to see a couple different doctors, and so we'll make sure that you have the ability to meet those people ahead of time. Or if you're just too overwhelmed, we can also just make your little list of doctors, and you can kind of see some of them and just have that little team of doctors ready for you later. Because families are overwhelmed. There can be diagnoses that you just have never heard of, and so you're first of all going to have to get education on that. So we provide that. We work with our librarians here to develop, specific to your diagnosis, some information, and we put that all in a binder. We hand it to you. The binder has like little spots for the doctor's cards to go in, so you can stay organized. Parents are very, like, when they're getting ready for a baby, they're nesting, so they want everything to be kind of like nice and organized, and like, this is ready, I'm going to be ready on that day. And so we help you do that too. We make sure you stay organized and you can kind of keep everything on track. So
really good. So yeah, you just mentioned it. We're not just referring inside our network. We're going all over, but that's to make a plan that works for each individual, parent or family, to work for them. So can that, again, anyone can use this network? Is that so?
Yeah, anyone can use the network, and so. Do you want to answer this question?
Yeah, actually, I just noticed we have a question.
And this kind of applies.
Yeah, so this is a question from someone in our audience. Do you connect dads to services, dad support?
Yeah, absolutely. And so what we love to see actually is an entire team of people coming in at these prenatal services, but the dads are going to be very important to come to that first visit with any of these subspecialty providers. And the reason is, and moms know this, when you're pregnant, you are hearing things, and then you are really kind of focusing on one thing or another thing, and you can have what's called this sort of like pregnancy brain, where it's a little bit hard to be objective. You're carrying a baby inside of you that has a problem, for example.
No big deal.
No, right. It's like a huge deal. So the dad can be there as like, hey, what about this question? What about this question? The dads themselves don't have any specific services yet in our program, but they do in each of our subspecialty programs. So say, for example, you have a baby with heart disease or a baby with spina bifida or some diagnosis like that. We also connect the family to the support group for that thing. So, and sometimes there's many support groups for that thing. So take, for example, Down syndrome. Your baby's diagnosed with Down syndrome. Before your baby gets here, you're going to meet with our Down syndrome coordinator who's going to explain to you kind of what services are here, and that would include services, for dads. But the support groups also, so the Down syndrome network, which in town is very strong, we connect you to them as well. So they're not Phoenix Children's affiliated, but they are because we take care of all their patients. And so the dads would be really important to kind of, first of all, be a listener, be somebody who's asking those questions that that people forget to ask. Dads also are extremely invested in whether or not that baby is going to do well. Dads are great planners, and so dads are always kind of like thinking about how does this affect the rest of the family, and what about time off work. They always will ask questions that make a big impact on that time right after delivery. And in some of our other networks and the other multidisciplinary programs we run, we've been trying more and more to try to figure out how to have specific support groups just for dads, because, no offense moms, but sometimes dads are actually end up being the person that raises some of these kids.
Yeah.
And when they come into the appointments, that can be a separate challenge for them because they don't have a mom around, and they need that kind of support.
Yeah.
So I think that's a great question and something that probably we need to include a specific dad support group.
Yeah.
It's a good idea.
Definitely. So I'm going to go back to this because we have new people join constantly. So I want to cover again what exactly a care coordinator does in this program and how they help throughout the course of a pregnancy.
Right. So a care coordinator, first thing they're going to do is answer the phone. So if it's your OB, your maternal fetal medicine doctor, if it's you yourself that calls and asks for help, they're going to get some information from you. Just let me get your name and kind of where you live and some information. Are you pregnant? How pregnant are you? What's going on with you? What's going on with the baby? They can hear from your answers what kind of a team they need to build for you, and then they're going to start explaining to you, okay, so say it's the OB that calls. The OB is probably going to tell us, I would like that family to get an MRI, so they need a special x-ray of the baby, and I'd like them to see a neurosurgeon. And so we will set all of that up by scheduling those things for you, and also helping to get them authorized, because your insurance company doesn't let you just make appointments for things. It seems interesting to me. I wish that was the case, where you could just do whatever you want, but you can't. And so you have to, your insurance company, in order to agree to pay something, has to have an authorization for that thing, whether it's a special x-ray or a special doctor. So we help get that done, because we found that while you're waiting to hear about whether or not it was authorized, you're waiting too long. The moms and dads are stressed. They want to be seen like now. And so we feel like the coordinator, one of their major jobs is to help speed that up. So if we get that authorization for you, we can speed that up. So you could be seen right away. So we do that. Then when you come for the appointments, we meet with you, like at the appointment. So my coordinators will go to your appointment. And that's another time when the dads are helpful, because after the appointment's over and the doctor leaves, that's when some of these questions will start coming up, and they can ask the coordinator, hey, I forgot to ask the doctor this. The coordinator can ask the doctor that and get back to you. The coordinator can answer questions that didn't come up.
Yeah, that's awesome.
And then they'll help get follow-up to you and to the doctor. So say you see a neurosurgeon, they'll get that neurosurgeon's report, and they'll make sure that that goes back to the doctor that sent you to us. So they're kind of doing the setup, they're doing the while you're here, and then they're doing the follow-up as well. Then they're tracking you throughout the whole pregnancy, so you can, you have this person in case there's any problems. After the baby's born, you can still call them. They get calls all the time.
Wow.
They get pictures from the families.
That's invaluable to have somebody. I mean, I can't even think of all the times I'm talking to a doctor and then they leave the room and you have like 1,000 questions you just remembered.
Right.
So we have 10 minutes left. I want to get to the next question that we have from somebody in the audience. Do you connect families to palliative care and pediatric hospice services?
Yeah, so that's a great question. So let me explain to people who don't know what palliative care and hospice services are. Palliative care just means you have a baby that's got a lot of challenges, and maybe even a baby that's not going to do well. And that can be so stressful. Just even the thought of that to me, and during my pregnancies, would have been so devastating. So we have specialists who can help think about that. And maybe the baby's going to be fine, but you're going to have special thought processes that have to be done after the baby's born. So a great example is some of the cardiac babies. If you know that the baby's going to have a bunch of challenges and you want to walk through all those scenarios after the baby's born, a palliative care specialist can help you do that. So they specialize in kids with special needs of any kind, and even babies that aren't going to do well. So babies that aren't going to make it, which is just, again, almost impossible to think about. But we, very early on in our program, we connected with Hospice of the Valley, and we have Pam Roman, who's one of our people with Hospice of the Valley, helps us with that. In-house, Phoenix Children's has palliative care experts as well. So you can meet with them and they can walk you through, okay, baby's born. Doctors are coming to you and the doctors are saying they want you, here's the options. Here's how you need to think about that. Or they're coming to you and they're saying that the baby's not doing well. We want to walk you through that so that if that happens, you have thought about it. And those, again, those are some of the worst things. But I can tell you that families who have been through that process and are connected and have thought about it, they don't have any regrets. They feel like they thought through things so that no matter what the outcome was, they did the very best thing they could for that baby. And those are the ones that really, I think, my main coordinator is Jessica Feltz. So when you call for the fetal patients, Jessica will hear, again, she'll ask you your questions, and she's asking you some questions, and she hears what you need. And if you need those services, hospice or palliative care, we set that up. Like, we know that, and we can set that up for you. We don't want you to think of it as we're giving up on your baby. We are the opposite of giving up on your baby. Like, we are so for your baby. True. And we want to be hopeful with you too. And so we always say, let's talk about those things and let's set them up so you can think about them. And then all of us are going to be hopeful together. And that includes the palliative care team. They're the most hopeful that you can imagine. But those are the kinds of things when Jessica answers the phone and she starts to set that up with a family. If you're a family who needs those services, you're gonna understand how invested she is in you.
Well, it's true, and her passion, that's for sure. I want to get to can you contact the network if your baby is already seeing pediatric specialists?
Yeah, you can. So a lot of times maybe we'll just tell you, you're all set. That's fine. You could call us and say, my baby has been diagnosed with this problem and I'm already set with this problem, or I'm already set with these doctors. Do I need anything else? And we might just set you up with the support group. Maybe there's a support group for that diagnosis in town. Or maybe you want to talk to us about needing a pediatrician, because we have, you might have a pediatric subspecialist, but do you have a pediatrician for the baby? If it's your first baby, it's great to have a neurosurgeon, but what if you don't have a pediatrician? You're going to need that too. The Phoenix Children's Care Network is a network of doctors around the entire city that are connected to PCH. They're not employed by PCH necessarily, they're just part of our network, so we can help you set up with that. In some cases, maybe you want a second opinion. I would say the care in Phoenix is very good, and a lot of times you don't need a second opinion, but if you want a second opinion, we can set you up with a second opinion, and they will not in any way steal your care or take you away from your providers. We never want to change providers if you already have them. But if you want a second opinion, you can get one, and then you can decide what you want to do from there. That doesn't happen that often. I would say most of the time people are calling us, they need that team built from scratch. I know there's certain things that we specialize in that the other places in town or the region do not. One is something that I'm involved in is called a cloaca. So it's when babies are born with like no holes on their bottom, or they don't have enough holes on their bottom. I know that sounds crazy, but it happens. And so I would love to take care of babies like that. So if they came to me for a second opinion, I would probably say, yeah, we have a whole program for that, so we would want you to be here. So there's certain things where I would just be really honest about what we have built. A lot of times it doesn't have to do with the doctors. It has to do with the coordinators, it has to do with the support groups, it has to do with the community of patients, because the doctors are somewhat interchangeable around the world, but if you've built a support community for a type of diagnosis, that's where I'd want to be if it was my kid. So.
Oh, definitely. So when, I want to circle back to kind of some of the questions we touched on in the beginning, but when should an expectant mom reach out, or expectant parent in general, mom or dad, reach out?
Yeah. So we like to hear about people as soon as there's something identified that can be a problem. And so a lot of times it's in one of those first ultrasounds or one of the first diagnostic tests. So that can be anywhere from 10 to 12 weeks. People are getting certain diagnostic tests that might come back abnormal. You can reach out to us then. At the ultrasound, you can reach out to us to tell us there's something going on with the baby or something going on with the mom. They can reach out to us anytime, but the earlier the better, because then we put you on our calendar of babies that are in the cooker, and we track you throughout the entire process.
Yeah.
If it's real late, which it can be, say something's diagnosed late in a pregnancy, especially if they're coming from another city, that's still okay. We still want to hear about it, because we'll scramble and we will get you a place to stay. We will make sure you have, we have a plan for transportation, we ask you questions about, let's talk about how many kids you have in your house. Do you have child care plans? We can't solve all problems, but we have a lot of services that are available in Arizona that we call for you. So services that sometimes come to your home to help you. There are funds that are donated by wonderful people that help you pay your bills if you did not know that you're going to be in the hospital with a sick baby for 3 months. So these kinds of things, we know those things exist, and we can't expect that and so anytime you call us, if we can't solve your problem, I can tell you we're going to try, but a lot of times we have resources that you don't know. So
it's just awesome. I mean, I've seen the passion of your team is so evident. So it's so true when she says that. And I want to quickly flag, too, that the number, again, is in the description of this segment, but it's 602-933-BABY. And you can call at any time, and someone will answer. A care coordinator will get back to you if they don't answer, and answer any questions you have.
I mean, Stacy even just can answer questions about birth plans. A lot of people have, kind of a complicated birth plan these days, and so they may not be able to ask their provider about all of those things. She can definitely talk to you about services for lactation. She can talk to you about services for depression. Depression is a big problem during pregnancy and after pregnancy. We definitely have resources for moms to deal with that, and so calling us for those services is sometimes a way for families to do it if they somehow don't want to ask their doctor, or if their doctor doesn't know the answer. So
we have a question coming in. Is there a plan to eventually have high-risk deliveries at PCH?
So that's a great question. So the answer is, we have a lot of respect for the obstetricians and the maternal fetal medicine docs in town. So if we did that, it would certainly be in conjunction with those doctors. If that happened, then obviously the Phoenix Children's subspecialists are right here ready to take care of the baby. But we would want to build the most amazing services for the mom, because it's normal for a mom to be like, it doesn't matter for me. I just want you to take care of my baby. To forget about me. No. You have to do well because you're going to take care of that baby. So it's a great question. It's not out of the realm of possibilities, but it would be dependent on building an amazing team for the family, for the mom, for the dad. We have talked about having these really family-friendly centers where everybody can be there. And if we built that, there's no question it would be like that too, where you could bring the whole team, the grandparents, the kids, everybody. But it's a great question, and it's a good future goal for the city to have something like that.
And maybe worth mentioning that we are the Women's and Children's Tower in Mercy Gilbert that is opening. So we announced that this year. You guys can check out some of our recent press releases, but there will be a Women's and Children's Tower in 2020 on the Mercy Gilbert Dignity campus.
So thank you everybody so much for taking the time to watch and be excited about our program with us.
Yes, thank you.
Please call us for anything you need at any time.
Thanks, everyone.